Now, let us discuss how we can diagnose these viral infections. Viral infections are diagnosed mainly based on the symptoms we already discussed, and if more than one member of the family suffers from the same symptoms. For example, if 3 or 4 members in the family have the same fever, cold, coughs, body pains, it's invariably viral infections. And we can confirm the viral infections by some tests. For example, if there are respiratory infections, we can do a PCR. The same PCR we used to do for the COVID. We can do the PCR and we can diagnose these viruses very well. Earlier, this test was not available, but after COVID, this PCR test is widely available in various towns and cities in India. Is it possible to diagnose a particular virus without testing? Most often it is difficult because the symptoms of these viruses overlap. In other words, most of these viruses cause fever, body pains, cold, cough, sore throat, etc. However, sometimes there may be some symptoms which might be able to tell us that it is that particular virus. For example, there is a loss of taste, might suggest that it could be COVID. Similarly, presence of severe body pains along with similar complaints in family members along with colds and cough might indicate that it is a flu virus. Presence of conjunctivitis, vomiting or diarrhea may suggest it's adenovirus, so on and so forth. But however, in many of the cases, most of the symptoms are similar in all these viral infections. Blood test may be necessary to confirm dengue fever, but in other cases, a PCR is useful. How can parents treat these infections at home? The treatment for viral infections is mainly symptomatic and supportive. Symptomatic meaning you mainly treat the symptoms. For example, if there is fever or body pains, you can give paracetamol. If symptoms are not controlled with paracetamol alone, you can give ibuprofen or any other medication. Parents can use sponging with lukewarm water to reduce the temperature. You should make sure that the child has plenty of fluids orally and also that the child takes good rest. Avoid sending your child to school when they have viral infections. Then parents ask about, can my child get an antibiotic? It's important to remember that antibiotics are antibacterial medications. They are useful only for bacterial infections and they have no role in treating viral infections. Similarly, we tend to overuse a lot of cold and cough medications. These cold and cough medications can cause unpleasant side effects like drowsiness, thickening of secretions leading to blocked nose and constipation, etc. These medicines should be used only if the symptoms are troublesome. For example, if there is any difficulty in breathing or sleeping at night time, parents can give 1 dose of this cold or cough syrup so that the child can have a quiet night. Then comes the question, when should I take my child to a pediatrician? There are 2 indications. One is if the symptoms are prolonged or if the symptoms are severe or troublesome. So the first indication, most of the viral infections get better in 2 to 5 days and sometimes up to a week. If a child is otherwise well and has only cold and cough with mild fever, you can wait up to 5 to 7 days before you see a doctor. If the symptoms prolong more than 5 to 7 days, then you can visit your doctor who will advise you any further tests or treatment as needed. However, if the child has any severe symptoms or so-called warning signs, you should not wait for 5 to 7 days but see the doctor immediately. This can include symptoms like breathlessness, which we already discussed. Child is not eating or drinking, urine output has come down, child has high grade fevers which are not getting controlled, child is not playing, not active, very drowsy. So when your child has this warning signs, you should take your child to a nearby doctor or emergency. Finally, how can we prevent these viral infections? COVID has taught us many hygienic measures as to how to prevent the spread of infections. We should continue these measures like hand hygiene, covering our mouth and nose when we cough and sneeze, avoiding going to school or workplace when we are sick. So following these measures in general will prevent the spread of infection. Similarly, using a mask when you are not well or during pandemics will prevent the spread. And particularly in children, regular use of vaccination will protect these children from vaccine preventable diseases. Parents sometimes ask, if I take a flu shot, will my child not get colds and coughs? Taking a flu shot will prevent infection from influenza or flu virus, which causes severe symptoms in children. However, it doesn't mean that your children will not have your coughs and colds, but it's important in some children to protect from flu. Similarly, parents will ask, what can I do to increase the immunity of my child? General measures like taking a balanced diet, which fruits and vegetables that contain all vitamins and minerals will help in boosting the immunity. Similarly, vaccination will help in boosting the immunity. And finally, parents should remember that as children get exposed to these viral infections in the first 1 or 2 years, their immune system becomes more developed to tackle these infections. And after 1 or 2 years, these infections become less frequent and severe. For example, we saw that between the first and third COVID waves, our immunity to COVID virus has increased and it's no longer a major problem as it used to be. Similarly, your children will gain immunity to the common viruses after a few years and they would not be as troublesome as before. Thank you.